Hi, good afternoon to all of you. I'm Dr. Bhavish Kotak. I'm the Vice President of Medical Services at Dr. Reddy's. Here today to talk about the product that we are launching in collaboration and strategic partnership with Sanofi. This product is nirsevimab or Beyfortus, which affords passive immunization against respiratory syncytial viruses and the illness that it causes, especially in infants in the first couple of years of their life. So RSV is predominantly the virus which causes most of the acute respiratory viral infections in children, accounting for almost 66%, two-thirds of the cases. Even if you use different pivots of hospital admission, the admissions to PICU, the severe diseases of LRTI, RSV predominates all these. And when RSV causes an infection, in vast majority of the infants, it's a very mild infection. But it doesn't mean that it doesn't cause severe infections. In a proportion of infants, it leads to lower respiratory tract infections like pneumonia and bronchiolitis. The infant lung is very immature and it causes more respiratory distress. It leads to admission in PICU, pediatric intensive care, and need for ventilation and oxygen. Now, there is no treatment for the virus, and the best way is to prevent this infection. What this product does is provides immunization right away at birth when it is administered as the first dose before discharge, and right away the immunity is available in the form of a monoclonal antibody. It is necessary because there is no biological marker or no way to predict which of these infants who get RSV will end up with a severe infection. Now, a small proportion of them would also end up in mortality, and it's a mortality which can be fully avoided. 97% of the worldwide burden of RSV infections resides in low-middle income countries, and India is one of them, a statistic that we look to change. Close to 100,000 deaths occur every year globally, the vast majority of them again in low and middle income countries, and it's a statistic that we want to address. And once you give this antibody, the protection is available for the full season. So the idea is to give it in the first season when the immunity is at the most immature in the child. Give it as a passive immunization. The immunization then gives them the ability to tackle this infection, and once the child grows older, then they are able to fight this virus off on their own if they ever come across it. The last number I would like to state is more than 50% of children get to encounter this virus in the form of an infection in the first year of their life, predominantly in the first 6 months when their immunity is at the sort of lowest. And 100%, close to 100%, more than 95% anyway, get exposed to this virus in the first 2 years of their life. It is not so much of a problem in adults because the immunity is strong by then. So we need to protect the children. Thank you.
Yeah, I am Dr. Vasant Kalatkar, National President, Indian Academy of Pediatrics, an organization of 49,000 members of pediatricians. So, talking about RSV, basically this is a very bad virus which affect only respiratory system. That to be very bad in children, and that to be up to age of 2 years. It can affect at the 1 day, it can affect 2 days, it can affect the elderly also. But the complications like a pneumonia, bronchiolitis, and all lung-related diseases are more common up to age of 2 years, because children up to 2 years don't have a best immune system to develop. They are very much prone for infection, and sometimes that can go to common lung disease, then it can ILD like this, and this can lead to exacerbation of asthma also. So this is a very critical. Last time we have seen cases in Kolkata, Bombay, Bangalore, Hyderabad. Those are metro cities that where it's notified. We don't know what is the status of a rural area, but definitely this is a droplet infection by spitting or through one-to-one contact. It can go. So this is the way of infection. And what is the complication? Child can go to pneumonia, child can get hospitalized and need a ventilation because of a respiratory stress, because lung volume become less. And child is having very lung volume as compared to adult. That's why, suppose you take the SpO2, you know that pulse oximeter, that if saturation less than 92 in children as compared to 85 in adult, we have to take the help of oxygen. So because of their low lung volume, and that's why such a disease where death can also occur, we can lose the child. It's a better way to prevent. So definitely it is going to help socio-economic status, our mental status, emotional and disease burden definitely. Because once hospitalized, you know how the expensive it's a child has to admit in ICU. That's why this is the vaccine nowadays available. It's a vaccine which can give the immunity up to 6 months to 1 year. So first dose to be given at the day one or before discharge from hospital. Whenever mother gets discharged from maternity hospital, before that you have to give. Either if suppose miss, then whenever that mother come for first visit, at least that time or up to 1 year. There are two type of doses are there, up to less than 5 kg and more than 5 kg.
Yes, I am the medical head for Sanofi for the international region, and I would like to share with you the global burden of disease for RSV. RSV is a virus that infects young children, and we can expect globally 33 million cases every year, which will have at least 3.6 million hospitalizations due to this virus, and children will experience this type of infection during the first year of life. Unfortunately, globally, it is estimated that 100,000 kids die per year because of RSV. And this is why, taking into account the huge birth cohort in India, more than 25 million children, we can expect that around 1 to 2% of these 25 million, which is, we're speaking about 500,000 babies, will be hospitalized by RSV. And this is why it's important to bring Beyfortus as a product which will prevent infection by RSV and which will prevent the complications due to RSV and, importantly, hospitalizations. So it's a product that has been prioritized by the company to be in the Indian market because of the importance of RSV and the amount of cases you will be seeing in the country. It's a very effective product. When used properly, this product can protect up to 90% can prevent up to 90% of hospitalization and those kids that go to the intensive care unit. So we are very glad to bring the product to India and to make it available, because we don't know, out of these kids who suffer from the infection, who will develop a complication and which of them will be hospitalized. Because there is no actual treatment for RSV, there is no specific antiviral or antibiotic for RSV, and we don't know which children will be hospitalized by RSV. Better to have a prevention measure as Beyfortus to protect them while they are experiencing their first infection during the first year of life.